The following portion of Studio 512 is sponsored by Advanced Pain Care. Pain, as we know, can make life unbearable, and it can also be really complex to treat. That's why Dr. Mark Malone, president and founder of Advanced Pain Care, created multidisciplinary care all under one roof. He's joining us to tell us more. Doctor, good morning, and let's first talk about what's new at APC, because it's been a while since we've seen you.
Good morning, Rosie. Yes, we continue to grow and expand. We're up to 15 locations now throughout Central Texas and into the Panhandle. We have 6 specialties to serve our chronic pain patients. We have 4 surgery centers and 3 pharmacies.
Wow, the numbers continue to grow.
Yes.
And it kind of all lends to what we talk about multidisciplinary care. So I'd like to ask about what drove you to create APC and kind of how your integration of specialties really helps patients.
Well, Rosie, there are multiple aspects to chronic pain, as you know, and we need all of these specialties within the house to get at each of these aspects. For example, one of the big questions in chronic pain is, does the patient need surgery? Well, to answer that question, we have our own neurosurgeons who are expert at knowing who needs surgery and who does not in-house to help us with that question.
Mm-hmm. And you said they're not obligated, to fill a schedule, to make a budget.
Right. Right. They work for us. They don't work by the case. They don't need to stack their schedules in order to make a living. Mm-hmm. So they have no incentive to give you an extra surgery that you might not need.
Let's talk about some of the ones that might surprise people.
Well, another specialty we have is addictionology, because we know that a lot of chronic pain patients have substance problems, mm-hmm. like they can't regulate the amount of medicine they take. They may feel like they need so much medicine they go out to the street looking for extra medicine. So we have addictionologists who are expert at managing and helping these people overcome their addiction.
I think people are shocked to find out that it's 50+ million Americans.
That's right.
Who are dealing with this.
Yeah, it's an enormous number of patients with chronic pain. And even more striking are the ones, it's not 50 million, but maybe a smaller number, maybe 5 million, that have such incredible pain they can't get out of bed.
And I think you bring up a really good point. So for my last question here, if somebody's watching this morning, they haven't reached out before, but they are living in chronic pain, what would you say to them about reaching out?
I say absolutely reach out. We can help you. There's no question. We have so many ways to help you now. Modern technology has really caught up to chronic pain, and we can block pain. We can essentially cure chronic pain.
That's incredible. Dr. Malone, thank you so much for your time.
You're welcome, Rosie. Thank you.
To learn more about what you could do if pain wasn't holding you back, talk to the doctors at Advanced Pain Care. Go to austinpaindoctor.com to get help managing your pain today. The preceding portion of Studio 512 was sponsored by Advanced Pain Care.